This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Welcome back to AM Northwest. Deep brain stimulation is used to treat many movement disorders, from Parkinson's to epilepsy. But what happens in the operating room is truly amazing. Here to share more, we welcome from Providence Brain and Spine Institute, functional neurosurgeon Seth Oliveria. Good to have you with us, Seth. This is kind of amazing. I always think of Michael J. Fox when I think of something like this. So first of all, tell me how it works.
So we place electrodes into small, deep structures in the brain, and the place where we put the electrodes, it helps to change the activity of malfunctioning circuits in the brain. That placement has to be very precise. 1 millimeter can be the difference between success and failure in the surgery. And so we actually wake patients up during the surgery.
How much can be a difference?
1 millimeter.
Wow.
Tiny little bit. And so because of that, we actually wake patients up during the surgery to test and make sure that it is placed ideally.
That is so incredible, because I think to myself now, is he not in pain? Your patient not in pain when you're doing any of this?
So luckily the brain doesn't have any pain fibers.
Wow.
And we just numb up the scalp and everything else doesn't have any sensation.
That is phenomenal. So what disorders do you treat? We talked about Parkinson's.
Yeah, so most commonly movement disorders, which include Parkinson's disease, dystonia, and essential tremor.
Okay, so anything that has kind of a movement to it, right?
So patients with movement disorders, as the name implies, typically those patients have problems with any movement of the body, and so it can be quite debilitating because it affects all aspects of their life: eating, talking, walking, all those sorts of things.
Yeah, I would think so. So you brought something to show us here, and tell me what this is.
So this is a deep brain stimulator device. This is the part that actually goes into the brain. These are the electrodes that go into the structure in the brain, and this is the pacemaker, essentially, device that goes into the chest, similar to what you see for heart procedures.
Why do you perform it when the patient's awake? So they can give you directions, or you can give the patient directions?
So as I said, it has to be very precise. We may change the position by 1 millimeter or more, and that can be the difference between success and failure. And so we actually do some test stimulation in the operating room to make sure that we have it perfectly placed.
Can you completely eliminate tremors?
So oftentimes the results are very dramatic. And frequently the results are immediate as soon as you turn the devices on, and that is basically the best part of my job, that we do that test stimulation and get a preview of what that's going to be like for the patient, and it's usually very exciting both for me and for the patient when things go perfectly.
How incredible! So you're saying patients that had trouble eating, walking, speaking, now can do all of that?
Yeah, and as I said, oftentimes it's immediate as soon as you turn the device on.
Okay, and so where does this device get placed?
So
ultimately,
this goes into the chest.
The chest,
right there, like a cardiac pacemaker.
Wow. Okay.
And then the rest of the electrodes go up, past the ear and then up into the head. So
how long does it last, and how often do you have to kind of tune up?
The benefit lasts as long as the device is in the patient's body, which typically forever. And the batteries do wear out and need to be replaced on the average somewhere from 4 to 6 years. But that's a very minor procedure to replace the battery.
You must be pretty happy with what you do, because you're changing people's lives.
It's very satisfying, and patients do very, very well. It's a relatively safe procedure. It is elective brain surgery, but patients do very well, and when that's the case, it's very satisfying.
Are you on the cutting edge of treatment for epilepsy?
Yes, so that's a different procedure that we perform, and that's something we perform a state-of-the-art procedure known as laser ablation for.
So that's different than the brain movement.
Yes, so that's a different procedure. Similar, it's also done through tiny devices that go into the brain, but in that case, it's actually a fiber optic cable. We actually do it minimally invasive, using tiny incisions, less than half an inch or so, just big enough to put these little bone anchors into the skull, and then we pass fiber optic cables through these to to ablate tissue that either causes seizures or is related to tumors, things like that. But we use intraoperative CAT scans and MRIs to really perform state-of-the-art minimally invasive brain surgery.
This is incredible. I know we have two important events we want to talk about. You have a program that's coming up, the Functional Neurosurgery Program. The number is there on your screen. Also, we'll be speaking with you at the Providence Festival of Trees, December 1st through the 2nd at the Oregon Convention Center. We'll put all that information for you on our website at k2.com. Doctor, thank you very much. That's fascinating stuff.
Thank you for having me.